Hello and welcome. With the government announcing vaccines for children between the ages of 15 and 18 and with a so-called precautionary dose being rolled out for senior citizens, the interface through which these doses will be logged, CoWIN, will also need to be updated. It's already in the process of being updated. So how will CoWIN now work? When will you be able to register for your dose? For example, if you are a senior citizen with comorbidities who requires that precautionary dose, or you are a 15 to 18-year-old teenager who wants to get the first of their vaccines as well. Joining us, R.S. Sharma. It's always wonderful to speak to Mr. Sharma. He's very much the brains and the key implementer behind the CoWIN app. Thanks, Mr. Sharma, very much for being with us. But first, I must ask you, for senior citizens, it's been called a precautionary dose, right? So, is that what CoWIN is also going to say, a precautionary dose?
Well, thank you, Vishnu, for inviting me on your channel. It's always a pleasure to talk to you. Yes, you are right. The CoWIN platform is merely a technology backbone, and it is actually going to implement the policies of the government. So if the government calls the additional dose as the precautionary dose, so the CoWIN is also going to call it the same. So that's the way it is going to happen.
So, sir, the reason I ask that is because presumably there would then be a fourth booster, a fourth shot as well, which would be called a booster in the future. I mean, I'm just trying to.
No, well, I can't sort of imagine as to what fourth will be called or what fifth will be called. Let's limit ourselves to this particular issue.
So it will be called a precautionary dose, and you are confirming that. I mean, that's important to note. So absolutely. If there is a senior citizen with comorbidities who is eligible, what does she or he need to do?
Well, first of all, he or she is already registered on our platform, right, because he or she has already got 2 doses, right? That's number one. And number two, we also know when was the last dose he or she took. So therefore, from that point onward, when are his or her 39 weeks or 9 months going to be completed? So as soon as that happens, the CoWIN platform will issue an SMS to him or her, informing him or her that, you know, your precautionary dose is now due in case you have comorbidity. Right. So in case he or she has, she can go to the CoWIN platform, use the same mobile number with which she or he had done 2 doses, and then get the appointment booked for the precautionary dose.
So this is important because all senior citizens will get an alert, and it's only those senior citizens who have comorbidities who may choose to act. Correct?
Correct. That's what we plan to do.
Right. So that's interesting. Yeah.
Yeah. So otherwise, you know, because we have all the data is with us. So we will inform the senior citizens that now you are eligible in case you have comorbidity. Similarly, we will also inform all the frontline and health workers to essentially say that now you have done these 2 doses have been administered to you. Your last dose was 9 months or more prior to today, and therefore you are also eligible for a precautionary dose, and please come and have that dose administered to you.
So if a senior citizen, sir, is to book that 3rd dose through CoWIN and have received 2 doses of, let's say, Covishield or Covaxin for that matter, as per the existing policy, and as I understand it, it's the same dose for the precautionary dose. So on the interface, will appointments only be for the vaccine that they've already taken?
Well, I must share with you that I am not very clear about the decision as to whether the 3rd dose, that precautionary dose, will be of the same, brand as the first 2 or a different brand. As and when that decision is taken, because this whole thing is going to happen from 10th January onwards. So, accordingly, the CoWIN platform will be configured to show only those centers which are different, or those centers which are the same centers, same dose which was taken by the person earlier.
Right. So that's again an important point. Whatever a person is eligible for will be shown on CoWIN, right? In terms of the appointment booking.
Absolutely.
Senior citizens also need to upload a document. What is that document, sir?
No, they don't need to upload a document, but as you know, there was a time when we had said that 45 to 60 years of age, people with comorbidity will be able to get a jab. You remember those
Yes.
initial periods? And then the Ministry of Health had prescribed absolutely detailed guidelines, which actually, prescribed as to what are the eligible conditions of comorbidity and what will be the format of the certificate. Those same rules will continue to apply in case of this comorbidity certificate also.
So that is an entry, sir? Is that an entry in CoWIN, or does an individual need to take, a letter from a doctor at the time of getting the injection after registering?
Absolutely. This is just the CoWIN is going to ask him or her that, do you suffer from comorbidity? If he says no, then obviously it will not allow him to register for the precautionary jab. But in case he or she says yes, then it will advise him or her that you take the certificate at the time of vaccination. And they will have to show to the vaccinator the certificate. The vaccinator may choose to upload that certificate in the CoWIN platform.
What if a vaccinator rejects the letter? Because that will happen quite frequently. It's bound to happen in a country as large as ours. What happens to the application an individual has made? Does it get erased?
It is not an application, it's a certificate by a doctor. So there is no question of its rejection if it is a valid certificate. Why should somebody reject the certificate?
So it's an assumption that all of the certificates which are given will be valid, and therefore the process of getting the injection should happen smoothly. Now, if you recall, sir, last year there was this big rush on vaccines because the number of vaccines were low, and that also had a bit of an impact on CoWIN as well, because I recall a time when, we were fighting to get a second jab, for example. There were just not enough spaces, just not enough spots. Do we have a sufficient number of vaccines now to ensure that your system will work efficiently in giving a person an appointment?
The system has always worked efficiently. So first of all, I want to sort of dissuade, or I want to contradict that.
No, I take your point. The system has worked. There weren't enough doses. Your hands were tied in a sense.
What we are saying is, I think that situation was a temporary situation,
right,
where the demand had outstripped the supply, so to say. But that situation does not exist anymore. We have adequate supply, and situation is eased out, so much so that 80% of the people are going and getting the jab without registration on CoWIN, which is good, that people can just walk in and get the vaccines. So I don't think such situation will arise now.
Let's talk about children, sir, 15 to 18-year-olds.
Right.
So what is a 15 to 18-year-old? How do they register on CoWIN? A 15-year-old is still a child, so would it be on their parents' device?
So, well, let me divide this problem. One is registration. So if the parents have husband and wife have already registered on their mobile, they can add 2 more, the children can be added. As long as the number of persons on a mobile registered is less than 4, equal to 4, they can add. If not, then a new mobile number can be used to create a separate account for the children. So that's one part. Secondly, this process is starting on 3rd of January. So we are opening the registration for children on 1st of January. That's 2 days before the vaccination. Thirdly, because children do not have the voter ID card or maybe driving licenses also, so therefore we are adding the school certificate, the school identity card, as one of the valid documents in case of children. Fourthly, the children, basically we are not going into the exact month and date and when will they complete 17 years or 15 years. We are saying, we are basically simplifying the process that anybody who is born in the year 2007, 2006 or 2005 is eligible for getting vaccinated. So
no, but sir, Mr. Sharma, wouldn't you then have a problem if these children want to travel abroad, and you had that entire issue with the UK who said they have a problem with CoWIN because the date of birth was not mentioned, and
we will basically, date of birth can be mentioned, and now those people who want to travel will also be able to link their passports with that. You are aware of all those things, changes which have been done in CoWIN. So therefore, that problem will not arise. But please understand, we believe in minimal data collection. We don't believe in, all kinds of data collection. So for 95% of the children, only year of birth will do. That's not a problem.
And those who want to get a specific date on their passport, they link it, right, on CoWIN, and that's it.
Absolutely. CoWIN has now the provisions for domestic certificate and also for international certificates. So those international certificates can be downloaded, linked with passport, and now our process is absolutely recognized by, the process is absolutely robust in terms of certificate. So also the certificate process will also be similar for children as it has been for the other categories of people.
So, sir, again, children don't need to upload anything. When they go for their shot, they need to carry their school ID or whatever it is that they have, Aadhaar card presumably.
Absolutely.
Right. So there is no uploading business over here.
There's no uploading business earlier also. There's no uploading business from the registration. There's no uploading business.
And walk-ins happen as usual. And if that happens, then it gets added onto CoWIN at a subsequent stage.
Absolutely.
Right. So all of these options.
CoWIN ultimately digitizes the process, either from the point of registration onwards, where the citizen takes the lead, or from the point of vaccination onwards, where the vaccinator takes the lead and enters the data.
So a final question, sir, to you. The next few days are going to mean a lot of work, for all of you, because as you mentioned, it's not entirely certain at this juncture which vaccines, for example, senior citizens will end up using, even children, for example. I asked because there's Zydus Cadila, which was also cleared earlier on by the government. But as per what we know so far, it's going to be Covaxin. So these are, for senior citizens, there are a couple of other vaccines which are being looked at very closely. For example, Covovax. So will it be the same vaccine or a separate vaccine? These are variables I assume you will factor in. So it's, time is running out. Is my point that there may be late changes.
Yeah, let me explain to you a little bit about this whole variable part. You see, this variable is nothing but data, and these are parameters as they are called in an equation. If one is dealt with a little bit of mathematics, then equation has parameters. So these are parameters which can be just put in at any point in time. So deletion, addition of vaccines, changing the age criteria, changing the other policy dimensions is all data. And that is very easy for us to plug into a platform. That is why we don't call CoWIN as an application. CoWIN is a platform. And we actually put rules into this platform, and the rules, whenever they change, they can be put in easily. So just to explain to you, it's not a difficult process for us.
No, it's not. I find it extremely easy, as easy an app as there is. Final question to you, sir, because we could keep talking for a long time. The alert will come on SMS and WhatsApp, or will it come on one of the two?
Well, it will come on SMS, but our partners, as you know, there are multiple partners who are also doing things on WhatsApp. They can also send the alerts on WhatsApp. We have no problems with that.
All right, Mr. Sharma, thank you very much for speaking to us and explaining what the process going forward for children and senior citizens is going to be. Thank you very much indeed.
Thank you very much, Vishnu, for having me on your platform.